Brantford Podiatry Associates. Busy, busy, busy?
Very much so.
Okay.
And it's International Foot Health
Oh, I'm
Month.
sorry.
We're not talking parochial here.
Okay. I love these things because it leads to like a billion questions. The first one being, is it all about the shoes, the number one mistake?
It's a very important factor, unquestionably. But what typically, with Foot Health Month, we're just trying to raise the general level of awareness. Every time, in the past when we've picked certain topics and things like that. But the biggest thing is just people thinking a little bit more about, when something goes wrong with their feet, who should they actually see? And that leads into what you were chatting about earlier.
Yeah, if my doctor says go see X, and X isn't a podiatrist or some kind of specialist.
Or a chiropodist.
Yeah, and I'm glad you said it because I always put the sh in there.
Yep.
So I want to make sure I got chiropodist so I get it right. You get the choice. And I mean, if you've got coverage, you don't have to go where the doctor sends you.
Yeah, first of all, in all fairness, and we talked about this on previous occasions, a lot of our family physicians aren't well educated on what we do.
Right.
There's not a lot of podiatrists and chiropodists in the province of Ontario, and they spend a lot more time treating feet than they should do, making the public aware of what we actually do and what services we provide. Recently I was sitting having a conversation with a couple of family physicians, or actually emergency room doctors, and they're going like, what do you do? And the topic came around to ingrown toenail surgery and our approach versus, so it's as much our problem as anything else. But as a general rule, if you're having issues with your feet and you're discussing it with your doctor, or you decide to bring it upon yourself to do something, go and see a podiatrist or a chiropodist, because that's all they do.
Yeah, no, it brings to mind a couple of really great questions on things you just mentioned. If my doctor is sending me to somebody who may not have the qualifications, education that you have, podiatrist, chiropodist, are they getting lobbied? Are these the guys that are kind of going to the doctor and saying, hey, got somebody with a foot problem, send it to me, and the doctor goes, well, okay.
I lobbied, maybe, some companies, some commercial enterprises do an amazingly good job of making their services known, especially some of the commercial organizations that manufacture orthotics, for example.
Right.
They very heavily promote themselves because that's the business they're in. For us, what we do is we diagnose the root cause of the problem. Then we decide, is the treatment of that problem within my scope, or do I better need you to see a physiotherapist or a physical therapist or a massage therapist, or do we need to refer you to a neurologist, or there's other people with other specialties, but as far as directing traffic, that's kind of what we do.
Now, I promised you two questions. Goes back about a dozen years. My son had a horrendous, you mentioned, ingrown toenail problems. Never was referred to anybody with your specialty, ended up with a surgeon and took out half the toenail, didn't work, took it all out on both big toes with the beds and the whole thing and all that kind of stuff. If I knew what I knew now, you would have been, what, the first step?
Well, the first thing I would have done was given you a good explanation as to what caused it. And too often you get lambasted with, you cut your nails wrong, or you were wearing too tight a shoe, or something daft like that. If it's chronic and you have no choice, yes, surgery's a great option, and you can do it painlessly and simply, and it'll look nice afterwards.
This wasn't painlessly.
I know. I hear the, again, well-intentioned, but that's all we do is simple little procedures on the feet.
I've got 30 seconds left, so I realize the biggest mistake people make, they put up with pain.
They do. And especially the international recognition this year is on adolescents. They're healthy, they're young, they're active, and they shouldn't be in pain. And if you're in pain, then you need to find the source of it, because it very rarely does it get better on its own.
Super. Dr. Mark Bradley, happy International Foot Health Month.
Thank you very much.
We're coming back. Soak your feet in alcohol. We can do that next. You'll see how.